Welcome to Code View. That day of a patient being able to go online and find her own medical record, that day has arrived. We'll tell you about that. We'll also tell you about a breakthrough project designed to help the Cone Health EDs break out and answer the question of why is a whirligig at Wesley Long? Those stories and more in this month's Code View. A big promise of electronic medical records is the ability of patients to see their own records online. That day has arrived thanks to a pilot project that includes several LeBauer healthcare practices.
I like the idea of being able to get my lab results quickly and actually seeing the values rather than having to wait until the next doctor visit to talk about what the actual values are and what they might mean.
Fuchs is one of around 1,500 Cone Health patients viewing lab results and communicating with her doctor through an online portal called MyChart. Dr. Stacy Blythe says MyChart is a key to the patient experience.
I think it's going to be a very useful tool. I think it's a necessary tool as the world changes around us. I think about it in terms of having a young adult daughter and then also having older in-laws, the different worlds that they knew. MyChart is kind of bridging.
MyChart opens to all Cone Health patients by the end of September. While workers race toward next month's opening of North Tower, the final project expansion is just getting started. Workers are adding a 6,000 square foot addition to the central energy plant. A smaller energy plant that heats, cools, and routes power and water to much of the Moses H. Cone Memorial Hospital contains 30-year-old equipment that will soon have to be replaced. This expansion provides a home for that new gear when that happens.
Timing is everything. Our old plant is 30 years old approaching. Timing is everything. We need to have this shell ready to receive equipment, to be able to receive it as the old equipment is replaced, programmed for replacement.
Replacement heating and air equipment will be twice as efficient as the technology being used in the old system. Congratulations to Janice Pascal, an environmental service tech at Annie Penn Hospital. Kathleen Linder, a behavioral health hospital counselor at MedCenter Kernersville. Doug Shoemate, a certified phlebotomist 2 at Cone Health Cancer Center. Sherry Jones, a clinic team leader at LeBauer Gastroenterology of Cone Health Medical Group. Steve Mabe, a nurse in the emergency department of MedCenter High Point. Francis Nichols, a vascular sonograph chief tech at Moses Cone Hospital. Jessica Cento, a clinical social worker of the system-wide division. Teresa Alston, a nurse tech 2 in the ICU step-down at Wesley Long Hospital, and Dawn Conrad, the admissions services supervisor at Women's Hospital. These outstanding employees live the Cone Health values and are the 2013 Cone Health Employees of the Year. They were honored at the Service Awards Banquet Evening with the Stars program in late April. Congratulations also to Bev Cleveland, Chief Financial Officer of the Cone Health Medical Group. Cleveland received the 2013 Triad Business Journal's Women in Business Award. She spent her entire working career at Cone Health, embracing opportunities to work at Moses Cone Hospital, Wesley Long Hospital, Women's Hospital, and LeBauer Healthcare.
Cone Health is a great place to work. I have been here almost 27 years, and I started as an accountant at Moses Cone Hospital and have been in various positions since that time, and have really enjoyed my time here at Cone. Cone has been more of a family to me as well as a place to work.
The award recognizes businesswomen in the Triad who demonstrate community and civic engagement, business management, mentoring, inspirational leadership, volunteerism, innovation, and executive leadership. Emergency departments everywhere face a variety of tough challenges. Cone Health has set up a breakthrough project with 4 ambitious goals for Cone Health EDs. It seeks to take care of patients faster, keep patients and staff safe, better handle behavioral health patients, and improve the overall emergency department experience for patients and staff alike.
We've always had staff that have, cared for our patients, who have wanted to do the best for the patient, and we still do. I think in the past, we weren't always able to do that as fast and efficiently as we wanted to. Come end of the year, I think you're going to notice some big improvements in throughput in the emergency department.
4 committees will tackle the issues throughout the remainder of the year. In our efforts to learn more about one another, the Cone Health Inclusion Council has set up a number of programs exploring Asian cultures in May. Employees who are part of the various cultures will staff booths in what's essentially a culture fair.
It is part of our wanting to make sure that we are recognizing the differences that we all bring here within Cone Health, how diverse we are. And the purpose of it is to, as we learn about it, is to make sure that we understand it and then we respect it.
You don't need to register, just drop by. The fairs are going on May 15th from 10 to 11:30 a.m. in the gym at the Behavioral Health Hospital, from noon to 1:30 on May 16th at Med Center Kernersville in the conference room, on May 17th from 9 to 10:30 a.m. at the Wesley Long Hospital Classroom 3, on May 29th from 10:30 to 11:30 a.m. in Classroom 6 of Women's Hospital, and from 2:30 to 4 p.m. that same day in the Annie Penn Hospital Dining Room. The final one is May 30th from 8:30 a.m. to 10 a.m. Moses Cone Hospital Heart and Vascular Center in the conference room. If you've ever dreamed of being a calendar pinup, here is your chance. Cone Health once again features wellness success stories of employees in the 2014 edition of the Wellness Calendar.
So if they lost weight through Weight Watchers, if they quit smoking through Quit Smart or our program through the outpatient pharmacy, or maybe they got control of one of their diseases through the Link to Wellness program, we want to hear about it.
The subject of the 12 stories selected will receive a $100 gift card and be featured in the 2014 Wellness Calendar. Send your entry of 250 words or less to Becca Jones, Wellness Coordinator, by May 31st. Finally this month we leave you with Saw Dogs. This whimsical whirligig awaits the wind next to the Wesley Long Hospital parking deck. It's the creation of 93-year-old Wallace Simpson, a North Carolina artist. The Public Art Endowment of the Greater Greensboro Community Foundation paid to have it brought to Wesley Long. Moses Cone and Wesley Long Hospital volunteers paid for the installation. This whirligig will be on the campus of Wesley Long for the next year to 18 months while a permanent whirligig park is being built in Wilson. That's it for this edition of Code View. I'm Doug Allred. We'll see you next month.